Since 1954, the Ventura County Medical Resource Foundation has built a reputation for providing access to quality medical care within our community. Ventura County Medical Resource Foundation's work has had an enormous reach over the past 5 decades, aiding sick babies and children in the neonatal and pediatric departments at VCMC, providing resources for the mobile mammography unit, and funding countywide senior health screenings in partnership with the Department of Public Health, and so much more. Focus on Children is an all-out effort every year for the Medical Resource Foundation. Funds raised are used to purchase much-needed medical equipment and support services for sick children. Ventura County Medical Center has the county's only pediatric hospitalist and will soon add the first dedicated pediatric intensive care director. Donations are vital resources to support the Pediatric Intensive Care Unit and Pediatric Oncology Department.
Tyler was diagnosed October of 2008. He was just getting really high fevers, like one right after another. They did the ultrasound and they told me that he had a Wilms tumor, he had cancer, and our whole lives turned upside down. Well, Ventura County Medical Center, the pediatric floor itself and the oncology floor, they're just wonderful. Dr. Bracho gives me the assurance that everything's gonna be okay. It would definitely be a lot more challenging if this clinic wasn't here. I don't know what I would do. It's a godsend, this place.
The Ventura County Medical Resource Foundation also seeks to underwrite costs of care for critically ill infants in the newborn intensive care nursery, which provides life-saving care and state-of-the-art equipment, such as special pediatric respirators, to help tiny premature infants and newborns breathe. These children, full of life and promise, are Ventura County Medical Resource Foundation's miracle children. Each of them spends critically important time in VCMC's newborn intensive care nursery on equipment donated by the foundation.
My name is Michelle Grimaldo, and my baby's name is Ashley Michelle Grimaldo. She weighed 1 pound 15 ounces at birth. I was diagnosed as a high-risk pregnancy. Here at VCMC NICU, very excellent care, and I'm just waiting for the time to get my daughter home safe. Actually, is doing wonderful. She's talking. She's ready to go to school. Having the NICU here at VCMC actually, saved my daughter's life. And since she was born until, I got her to go home, they just took care of her and gave her the needs that she needed. And I think it's very important that they do have this for other kids that are born in the future. I would like to thank everybody who has donated money to the NICU, and I will ask them again to donate money to help these little lives, to save their lives, because the NICU did save my daughter's life.
Ventura County Medical Resource Foundation's focus on preventative care helps keep our county healthy. Your support helps fund county-wide senior health screenings, provides resources for the mobile mammography vehicle, supports research into Parkinson's disease, and education for seniors on disease prevention and chronic disease symposiums.
Over the last couple of years, the campaign has focused on the needs of our seniors. We know it's a growing population, and we know that they have chronic disease challenges, they have lifestyle disease challenges, and we're able to put together programs that are targeted specifically for our seniors and general support for what their needs are to be a healthier senior, living a quality of life that they all wish to live.
Everyone knows someone who has been touched by the county healthcare system, a sister, a mother, a father, a close friend. Having quality health care in our community is vital. But in this time of rapidly advancing medical technology and shrinking budgets for health care, the needs are greater now than ever before. Every contribution makes a difference, no matter how big or how small. They come together to help provide quality care to our community. from the tiniest little ones in the NICU to our vibrant senior community. We couldn't do this without your support.
Hi, my name is Dr. Eunha Cho with Camarillo Children's Dental Group. I believe Children's Resource Program is important because it provides for children in need of dental care in Ventura County. This is dental care that would otherwise be unavailable, resulting in poor oral health, poor performance in school, and poor self-esteem for children.
Quiero dar gracias a CRP y al Dr. Cho por sus servicios que nos dieron para nuestro hijo, que aliviaron su dolor que tenía. De veras estamos agradecidos. Gracias.
I urge my fellow colleagues to donate or contribute to Children's Resource Program to help children that would otherwise fall through the cracks. Thank you to Children's Resource Program for providing an invaluable service to the children of Ventura County.
We would like to express our sincere appreciation to the Ventura County Medical Resource Foundation for this honor and recognition. We, the madrinas of the Rebozo Festival, share the same goals and concerns with VCMRF. We also support a compassionate connection between caring and need. Many of the madrinas have been Ventura County residents for multi-generation. We, as many of you, care very much for the less fortunate in our diverse community. It is our pleasure to collaborate with our fellow nonprofits for the betterment of the residents of our great county of Ventura. In 2005, a small but powerful group of 18 women, Las Madrinas, which translates to Godmother, gathered and organized the first annual Rebozo Festival. This unique cultural festival promotes the rich heritage of our area by highlighting the colorful Rebozo shawl as our theme. The Rebozo embodies the warmth, comfort, and nurturing traditions of our Mexican heritage. This event was established to raise funds for Ventura County nonprofit charitable organizations that promote and support the preventative health, education, social, and cultural needs of our community. To date, we have raised over $200,000 for worthy nonprofit organizations in our local area. We look forward to continue many more years of shared collaboration and investment for the promise and positive future of Ventura County residents, and invite you to the 9th Annual Rebozo Festival to be held on Sunday, May 19th, 2013 at the historic Camarillo Ranch. Thank you again on behalf of the Madrinas for this recognition and honor.
Good evening. I am honored to be the recipient of the David Fainer Dentist of the Year. First of all, I would like to thank the Ventura County Medical Resource Foundation and its nominating committee for this recognition. I would also like to acknowledge the efforts of the staff and volunteers, as well as the financial contributors that make the work of the Ventura County Medical Resource Foundation possible. I come from humble beginnings. I was born in Tijuana, Baja California, number 7 of 8 children of Miguel and Maria Valdez. When we moved to this country, I was a year old. The woman who sold my father our house in Montebello, which is just east of Los Angeles, told our longtime neighbor, "Mr. Hummel, I have good news and bad news." "What's the good news, Mrs. Wadley?" "I sold the house." "What's the bad news?" "I sold it to a family with 8 kids from Tijuana." From these humble beginnings, my siblings and I all attended college, thanks to the hard work and encouragement of our parents. The 3 youngest brothers, including myself, were the only ones born in Tijuana. And interestingly enough, we all became dentists. There must have been something in the water. The rest of my siblings were successful in their chosen careers. Given my background, it is easy for me to relate with those less fortunate. Volunteering is a way to give back to the community that has given so much to my family and me. Helping someone less fortunate is good for the soul. When it is done with dignity and respect, it allows you to see the real person behind the poverty and bad circumstances. I treated one young man in the Juvenile Justice Center in Oxnard. I didn't know what he had been incarcerated for, and I never asked. But he was in dire need of treatment. He didn't want me to do anything but an exam. He said he didn't want to be numb, miss dinner, and possibly feel some pain. I told him I had my iPod and I'd let him listen to music. "Do you have any rap?" he asked. I put on a rap playlist with Tupac Shakur. Next thing you know, he's lying on the chair, music full blast, moving his shoulders, lip-syncing the lyrics. After about an hour and a half, I told him to hang in there, I was almost done. He responded by saying, "Take your time, do the other side." I have numerous stories just like that, some humorous, some heartbreaking. I have thoroughly enjoyed my 34 years in dentistry, but volunteering has made it richer. After helping those less fortunate, one always leaves feeling more appreciative of the many gifts that have been given to us. I accept this award for those that give back to their community, and especially those that blazed the trails and made it possible for us to do so. Thank you to my family for the support, and thank you again for this recognition.
I am so very honored, grateful, humbled, and surprised to be the recipient of the 2013 Hospital Nurse of the Year Fainer Award. I thank the Ventura County Medical Resource Foundation and all those who have made this special event possible. I also wish to thank and acknowledge all the employees at the Ventura County Medical Center that have provided support and encouragement to me in my last 25 years of service as a surgical nurse. Although their names are too numerous to mention, each person will always be treasured in my heart. I have always felt privileged and proud to be a part of the VCMC surgical team, working with some of the most outstanding surgeons and anesthesiologists. The dedication, talents, and professionalism of all the operating room staff have been an inspiration for me. Their commitment to quality patient care has helped me grow both professionally and as an individual. Ventura County Medical Center's recent designation as a trauma center is something I am very proud of and I believe is well deserved. The highly competent staff and distinguished surgeons and anesthesiologists have provided compassionate care to those in need through their hard work and personal sacrifices. Finally, I would like to thank my family, my husband Mike, and my daughter Erica for their love and support.
Good evening and thank you for being here. I am truly honored and humbled to receive the 2013 David Fainer Community Nurse Award. The past and current recipients all hold my deepest respect and admiration. It is an absolute privilege to be included with these fine individuals. I would first like to thank the Ventura County Medical Resource Foundation and their sponsors for making this night possible. I so appreciate all the hard work of Vicki Chandler and her committee members. It is no small undertaking to organize an event such as this, and I hope it is very successful in raising funds that will help the foundation continue its mission to enhance the availability and quality of healthcare services in Ventura County. As a public health nurse in our community, I have seen firsthand those who benefit from the foundation's work, such as an uninsured child in need of dental work, a substance-abusing mother receiving the support of the Dependency Drug Court team, or an uninsured mother who would benefit desperately from a mammogram. I would also like to thank those who nominated me for this award. It is a tremendous honor to know that my colleagues and friends recognize the work I do in our community. I am blessed to work with so many dedicated and amazing people at Community Health Nursing, and without their support, kindness, and incredible listening abilities, I would not be here tonight. Their patience with my passion for birth and mothers and babies in our community does not go unrecognized. I must also include a special thank you to our nursing leadership for their vision towards prevention and strengthening the bonds of parents and their children in our community. I would also like to thank my clients for the faith they put in me by welcoming me into their homes to provide them with education, support, and referrals to the many community agencies that public health collaborates with. My clients teach me daily about the meaning of persistence, strength, and love. And finally, on a personal note, I would like to thank my family, the joy of my life. To my husband, my daughters and their husbands, and my beautiful grandchildren, your love, support, and encouragement lift me up on a daily basis. I love you all so much.
Although I'm greatly honored to be selected as a recipient of the Ventura County Medical Resource Foundation's Fainer Award, I as an individual don't deserve it and can only accept it on behalf of all the Ventura County behavioral health staff, contractors, and many partners whose sole goal is to help those suffering from mental illness and substance use disorders achieve recovery. This list of partners and supporters, which is far from complete, includes the Ventura County Healthcare Agency and its divisions, the Ventura County CEO's office, the Public Guardian's office, local law enforcement, schools, and of course, the Ventura County Board of Supervisors. If I can take any credit at all, it's for being in the right place at the right time. Years ago, before integration and patient-centered care was part of anyone's lexicon, Dr. Gonzalez was speaking of the shortened life expectancy of the seriously and persistently mentally ill, of the poor health care outcomes of patients in primary care with unrecognized depression, the increased morbidity and health care costs associated with untreated substance use disorders, and of the need to break down the silos that existed between care providers. What a blessing it is to have as an agency director someone who truly is a champion for patient-centered care, and how fortunate we are to have leaders throughout the healthcare agency such as VCMC's COO, Cindy Cole, Medical Director Dr. John Fankhauser, Ambulatory Cares Director Jonah Rahu, Medical Directors Dr. Michelle Laba and Dr. Dwayne Pearson, and of course VCBH Director Melanie Roy, who are all champions of patient-centered care. I would like to thank the Ventura County Medical Resource Foundation and all of you for the work you do and the support you provide to those with mental illness and substance use disorders in their journey to wellness.
Opened on February 14, 2012, The Ventura County Medical Center Harriet Samuelson Pediatric Intensive Care Unit has treated more than 200 seriously ill children over the past 12 months with everything from pneumonia to meningitis to trauma.
We have a challenge in the pediatric ICU because we need equipment to work on the littlest of people and equipment that works on almost the biggest of people. So we need little tiny face masks, and we also need little tiny breathing tubes, and we need ventilators that can work on little tiny children.
Noah went in for pneumonia, and it had been the first time we'd ever dealt with her here in the area dealing with something as serious as pneumonia. She was having severe symptoms of respiratory distress, and she was transferred to the Ventura County PICU, and just the people there just made the whole experience just so much easier on us.
Staffed 24/7 by specially trained pediatric ICU doctors, nurses, specialists, and therapists, the PICU has been an important medical service to Ventura County families with gravely ill children.
We were comfortable going back there because I knew that Dr. Markham was there. He just gave us full confidence. He asked us and let us know that if she went back to the ER that he would find out from us what we wanted to do and how we wanted the situation handled.
The PICU Tree of Life is dedicated to the many chronically ill children who have touched our lives at VCMC. Taken collectively, the leaves remind us of our patients who have helped us become better doctors, better nurses, and a better PICU.
My son, Nicholas, was born in March of 2011. He was born in UCLA. He was there for about 9 months. He was born with a lot of health issues, so since the PICU in Ventura opened in February, Nicholas has been a regular. They know how to take care of my son, and they know him. They know him very well. They know what he doesn't like and what he does like.
Before the opening of VCMC's PICU, Ventura County families were forced to travel long distances to receive specialized pediatric care for their children.
Having the PICU here is so comforting because knowing that we can just drive 10 minutes and be home and then come and visit her anytime that we want is such a great feeling.
The opening of the PICU would not have been possible without the gift of many supporters. Thank you to everyone who helped build the PICU, all the staff who provide patient care each day to the PICU patients, and most especially to all of you who support the PICU.
We wanted to say thank you to all the PICU staff, the wonderful nurses, respiratory therapists that made us comfortable and made her comfortable overall, and just showed her love when we couldn't be there to necessarily give her that love and support.
I want to say thank you for all your help and for making it so personal with us, getting to know me and Nicholas especially.
The Ventura County Healthcare Agency would like to thank the Ventura County Board of Supervisors and Ventura County CEO Michael Powers for their continued support of Ventura County Medical Center's Harriet H. Samuelson Pediatric Intensive Care Unit.
It's a great honor this evening to receive the David C. Fainer Award as the Physician Emeritus of the Year. Well, Emeritus, I hope that doesn't mean that I have to quit working now. I had a wonderful clinic this afternoon, and I expect to be back next week, both in the clinics and teaching. However, it's been an even greater honor to have served with so many wonderful and talented and dedicated people here at VCMC over the last 30 years. It was about mid-1982 that I started to feel burnt out. I had an extremely large private medical practice in the San Fernando Valley, and I ran into a colleague who informed me that there was a Dr. Fainer in Ventura who had some health issues and was looking for someone to replace him as Director of Internal Medicine. So I responded to that. Dr. Fainer interviewed me. He said I'd be perfect for that position, but unfortunately he'd already offered it to an internist in Pasadena a day or so before I had contacted him. Well, fortunately for me, that doctor's wife felt that living in Pasadena was far superior to being here in Ventura. Well, that was their error and my good fortune. Ventura, as you all know, is a wonderful place. VCMC is a terrific institution to be associated with. I was even more fortunate in that I had Dr. Fainer as a mentor. Even though he had stepped down as Director of Internal Medicine, he was still the Medical Director and Director of the Residency Program. I'd already had over 17 years of hospital and medical practice in the Valley, and I was already teaching at USC, but Dr. Fainer's approach to the patient, his approach to teaching, and the way he worked with all the people was an inspiration for me as well as to many others. So I'll always be grateful both to him and to Dr. Leo Tauber, who was also one of my mentors. Well, over the last 30 years, I've served in many positions here in Ventura. I was Director of Internal Medicine, Director of the ICU and CCU, a hospitalist for many years, attending physicians as of today also to the residents. I helped to direct the internal medicine medical conferences and educational program. I was a primary doctor to a very interesting, large, diverse group of patients in our family care system. And I served in several of our medical specialty clinics, both here at VCMC and throughout the county. Now, all of this was made so worthwhile by the superb physicians, nurses, and administrative and supportive staff that we have here at VCMC. They've all been a pleasure to work with. They are so dedicated and talented. I'm really thankful to them all. But I'd especially like to honor the physician leadership and the administrative individuals both at the hospital and the county who had the great foresight to establish our large clinic system that brings healthcare to so many patients throughout the entire county. And for also having built such a talented group of physicians both in primary care and specialists that have made our institution to be so outstanding. To those who nominated me for this award, to the David C. Fainer Awards Committee and Vicki Chandler, and the Ventura County Medical Research Foundation that has provided such great support both to our patients and our institution, my deepest thanks. And really a special thanks to my wife, Harriet, of over 55 years. Many of you know me and you know that it's a wonder that she's put up with me for all these years. Also, thankfully, of our 4 children, their spouses, and our 11 grandchildren, many of whom are here this evening. Of course, that in life is what makes everything worthwhile. I'll always be grateful for that chance conversation I had with that physician colleague that brought me to VCMC and to Dr. Fainer. It has been and continues to be a most meaningful and wonderful adventure to be here at VCMC. So thank you, and I hope all of you enjoy the rest of the evening.
Good evening, and many thanks to all of you here tonight to celebrate in honor of Dr. David C. Fainer. I am deeply humbled to accept this honor, one that I have celebrated for others for many years. I still remember working and attending my first event to honor Dr. Leo Tauber in 1994. I count myself fortunate to have joined the extraordinary Ventura County health professionals, the teachers, in fact the whole team that ensures the people of Ventura County receive the highest level, the highest quality of care every day. In fact, this remains the very reason that so many of us work and care for people within the Ventura County Healthcare Agency. We have the opportunity to strive for the stars in ourselves, in furthering education and in the care of people who entrust us with their lives and their families. This is a treasure beyond measure, and I am thankful for this gift every day. I am thankful for many such gifts. In joining the Ventura County Healthcare Agency years ago, I became part of a team with high expectations, many passed down from the educational professionals who worked alongside Dr. Fainer. Many of these amazing physicians, my mentors, have been honored here at the Fainer Awards over the years, and to that end, I certainly had no inkling that I might join them at some point. I'm not sure how the years passed so quickly. It was a privilege to join the Ventura County Family Medicine Residency Program faculty, and I have enjoyed many years of training resident physicians. As many of you know, this is where I derive a large portion of personal pleasure, no less than the pleasure of caring for my own patients, and it is the opportunity to mentor the future physicians in the same way that I was, with the high ideals, the high expectations to expect no less than the best for our patients, our staff, and the people of Ventura County. I believe in my heart that as Dr. Fainer asked health professionals, like Dr. Eric Leibovich, who is honored tonight, they were asked to join him in expanding into the future to move a general medicine training program into the new family medicine or family practice residency program. He had a vision of excellence and a vision of what the future would hold. I believe he had a vision of just this: generations of health professionals within the context of a team approach, ensuring success and building for the future. I am thankful to have been a small part of this vision, to be honored this evening in the name of David C. Fainer. There are so many people who teach, support, and allow each health professional to accomplish success for patients. I would like to acknowledge some of the people behind what I call the Wizard of Oz curtain: the nurses, the staff, the administration, the Ventura County Medical Resource Foundation, and the Ventura County Board of Supervisors, as well as many others who lay the groundwork to ensure the very best is offered to everyone who walks through our doors. I would also like to extend special thanks to the teams who have helped me to reach for the stars. The residency directors, including Dr. Lanyard Dial and Tom Dunlap. Mentors such as Drs. John Greenwald, Bob Lefkowitz, and Robert Gonzalez. And my most important home team, my family. I am joined this evening by my amazing parents, Orrin and Elena Lambing, my husband, Robert Fastenau, and my two daughters, Ashley Lynn and Caitlin. I am deeply grateful to all of these teams in allowing me to dream. MD. MD means to me being a medical detective, and I enjoy the challenge each day. I learned it from the amazing health professionals who shaped me, and I walk in their great footsteps. Thank you for the opportunity to care for patients and to train the future generation of caring physicians. Over the years, the heroes in healthcare have been honored here in the name of David C. Fainer. I believe, let me make a correction to that. I know that David C. Fainer would be really proud of his legacy. Thank you and enjoy your evening.
I am both honored and humbled to have my name associated with David Fainer. David Fainer was the residency director and Fran Larson was chief resident when I started my first year of residency in 1975. I was privileged to have such wonderful and inspirational mentoring early in my career. David Fainer was brilliant, compassionate, and practical in his approach to patient care and teaching. He taught and practiced by the concept that caring for the patient meant caring about the patient. He instilled a true culture of caring at Ventura County Medical Center, at that time simply the Ventura County Hospital, and the healthcare agency. Despite many changes over the years, that culture of caring has persisted and poises us well for what I think the new healthcare paradigm of measuring our worth will be. Not by relative value units, but by patient outcome. To care about the patient means caring about the patient's outcome. That means making the right diagnosis efficiently without excessive testing and with minimal risk. It means choosing the treatment option with the best risk-to-benefit ratio for each patient. It means committing to be of service to all of our patients. It means teaching our residents well. I want to thank my emergency room colleagues, the emergency room nurses, ancillary staff, consulting and residency staff for making Ventura County Medical Center Emergency Room an excellent care provider. As well, I want to thank our emergency medical services providers for making Ventura County one of the nation's leading EMS systems when measured by outcome. I am honored and proud to have been and continue to be part of both. I must honor my grandfather, Leroy Jensen, who as a true country doctor in Western Iowa inspired me to go into primary care medicine. Thank you to my wife, Ann, who has stood by me for 35 years, and to my children, Tara and Dana, and grandchildren, Kalia and Emily that give me great joy. Thank you to the Ventura County Medical Resource Foundation for this honor and for supporting our cause of patient care.
Good evening. I want to thank the Medical Resource Foundation for this recognition. Theodore Roosevelt said, "Far and away the best prize that life has to offer is the chance to work hard at work worth doing." How many of you can say that you love what you do for a living and are excited to go to work every day because of the potential? The potential to help someone in need, to make something better for someone you work with, or to simply keep things moving in a positive direction. Don't get me wrong, work is not without its struggles, but when you have the right team and the best people, it all comes together. We do have the right team and the best people. Ventura County Medical Center and Santa Paula Hospital have the best staff, physicians, and volunteers that I have ever had the good fortune to work with. Each and every day, they put our patients first, making sure that the care they receive is of the highest caliber. I want to take a moment to highlight some of our newer programs. Our Trauma Center, which began in 2010. Recently, I was exposed to this service from the patient family side. Out of a devastating crash came a life spared. This due to the amazing staff in the emergency department, intensive care unit, and case management department, as well as the physicians who stop at nothing to make certain each patient has what is needed to get the best outcome. How fortunate this county is to have such a trauma center. I would like to thank our County Board of Supervisors and our County CEO, Mike Powers, for believing in our system and recognizing the potential of VCMC being a trauma center. Our Pediatric Intensive Care Unit, which opened just this past February. It has provided care to nearly 200 patients. This care would not be happening in Ventura County without the true dedication of the staff and nurses who work in the PICU and Dr. Markham, as well as the commitment from so many other people who helped to get this new program off the ground. Over the next few years, we are going to experience another new and exciting project. We will be building a hospital replacement wing. This will replace 120 beds from our older buildings. We have a model of this here tonight, as well as storyboards to give you an idea of the magnitude of the project, as well as the beauty of what our hospital will be in 2017. Again, this is something we couldn't do without the support of our Board of Supervisors and our County CEO. Their recognition and belief in our system can never go unrecognized or unappreciated, so I thank you. Along my path, I have been blessed with amazing mentors, both in the nursing profession and in hospital and healthcare agency leadership. Many of you are here tonight. Thank you for your willingness to teach and coach me along the way. Once, I allegedly pounded on the desk of a past hospital administrator, demanding justice for the nurses. Now I sit behind that desk, wondering when someone might do that to me. I hope that I am as gracious as you were, Pierre. One person in this room took a leap of faith by giving me the opportunity to be the nurse leader for VCMC in 2003. For the past 10 years, working with you has been an experience beyond anything I could have imagined. We abolished traveling nurses, met the mandated nursing ratios by adding just the right amount of nurses, opened Santa Paula Hospital with the help of many people who are here tonight. We went through a few Joint Commission surveys successfully, and I could go on, but I have a time limit on my speech. Most importantly, we made sure that each of our patients had what they needed for their care. Thank you, Mike. As I move into my new role this year, I am fortunate to have guidance and mentoring from Dr. Gonzalez. We are an odd combination, an ER nurse and an internal medicine doc. Some of you out there get the irony of this statement. Thank you, Dr. Gonzalez, for believing in me and being patient. And finally, saving the best for last, my children who are here tonight. Aaron and Morgan, thank you for believing in me. My work life would not be what it is without your support over the years. My world is full and I am blessed because of you.
We were more than a little surprised to receive the message that we had been chosen as the co-volunteers of the year for VCMRF. There is a wonderful group of deserving volunteers who have previously received this award, and we are honored to join that group. Frankly, we don't think we joined the group alone. There are many, many people in our community many in the audience tonight, who have contributed countless hours of valuable volunteer work and expertise on behalf of VCMRF. We believe we are accepting this award on behalf of all of the men and women who work so hard to provide assistance to the underserved in our community.
It is easy and rewarding to volunteer with and on behalf of the Foundation. For years, VCMRF has answered the call on behalf of our fellow community members in need by providing health services to those who would otherwise not receive assistance, often in their most dire time of need. Gaps have been filled, programs have been established, and equipment has been provided by the efforts of VCMRF. Both of us have worked in our county juvenile justice system, and Kathy was particularly happy to collaborate with VCMRF in building a dental unit inside our juvenile facility. As you all know, this is just one example of the wonderful work done by VCMRF. We want to thank the Foundation for giving us the opportunity to volunteer for those in our community who are in need of assistance. We also want to thank Vicki Chandler, the Executive Director of VCMRF, for all that she does to keep the Foundation focused on its community mission, a job she has done and continues to do so well. On a personal note, I was surprised to learn that the term volunteer was apparently the same as indentured servitude. Kathy is really the volunteer, and I volunteer to the extent that Kathy directs me to do so. It is a symbiotic relationship that has worked well for just shy of 40 years, and we are happy that in a small way it has also benefited VCMRF and the people it serves. We both thank you very much for this honor.